Hello everyone, I am Dr. Manish Kumar Yadav. I am a Senior Consultant, Neuro and Vascular Interventional Radiology at KIMSHEALTH, Trivandrum. Today I will be talking about stroke. So as you know, stroke is kind of brain attack where a part of the brain stops functioning. There are many causes of stroke, but broadly it is divided into the one because of the bleeding, or the second one which is because of absence of blood supply to some areas of the brain. The one because of the bleeding can be due to blood pressure problem, or it can be due to bursting of one of the arteries. If the artery burst is the problem, today we have a non-surgical solution for it, which is called as endovascular embolization. What we do is through the leg arteries go and reach one of these blood vessels which has ruptured and put some platinum coils inside. What these coils do is they repair the blood vessel, and the blood vessels gradually heals and it becomes normal. It is done to prevent future bleeding. Previously all these patients were being treated by surgery, but today a non-surgical option is available. The advantage of this treatment is rapid recovery. The patient can recover absolutely quite rapidly as there is no surgery or scar involved. These procedures can be done in a specialized machine known as the cath lab system. There are other causes of bleeding inside the brain, such as arteriovenous malformation or dural arteriovenous fistula. Most of these patients either present with headache, which are chronic in nature, or sometimes they can present with seizures. So if you have any of these symptoms for a long period of time, it's better to get screened and by an imaging, either an MRI or a CT scan. Many times you may be required to inject some contrast or a special procedures such as angiograms. Once the angiogram is done and the diagnosis is made, it can be treated. Coming to the second part of the stroke, which is ischemic stroke. Basically, when the blood supply to one of the parts of the brain is occluded by a clot, it results in dysfunction of the brain, which is called stroke. So what are the manifestations of stroke? It is caused by the acronym of BFAST. BFAST means first is the B. B is the balance. That means if you find somebody who is not able to walk in a straight line, or he is kind of limping or swaying towards one side, it can be a stroke. The second acronym is EYES. If you think that some person whose vision was absolutely normal till some time back and is having a defective vision, it can be a stroke. F means the face. If you think somebody had a face which was very symmetrical and now there is any change in the face, it could be a manifestation of stroke. Coming to the next letter, which is A. A is the arm. If you shake hand with somebody and he does not have enough grip, or he is not able to lift his arm, it could be a sign of stroke. S is the speech. If you think that somebody is not able to speak properly, that could be a manifestation again of stroke. T is the time, or time to call the stroke unit. So if you find anybody with these manifestations of stroke, it is important to seek treatment early. Previously, it was treated traditionally by clot dissolving medicine, which had to be given within few hours. But today, along with the medicine, we have other treatment options such as a mechanical thrombectomy. So what we do in mechanical thrombectomy is go through the leg artery, identify the site of occlusion and remove the clot. The main advantage is the medicine does not work when the clot burden is larger. So that's where this treatment works. Second advantage is it can be offered to a longer duration after the stroke. But it is important to seek treatment as early as possible, as the salvageable brain keeps reducing with time delay from the onset. If there is too much delay, there may not be any benefit from the treatment. That's the importance of seeking treatment early.